We live in a sea of disease. When we think the word outbreak, we think about things that explosively affect people and make people to become ill. Our two biggest outbreaks are tuberculosis and HIV. And of course, everyone's tired of hearing of those, and we don't usually refer to those as outbreaks, but they actually are. Some outbreaks are very difficult to get to the bottom of, and this Listeria outbreak is an example of that. Listeria can be a really horrible illness. And people who have underlying risk factors, like persons who live with HIV or persons who are on cancer chemotherapy, or the elderly, people over 65, can cause meningitis, that's infection of the brain, bacteremia or sepsis when the bloodstream gets infected, and it can cause pregnant moms to lose their babies. The food is contaminated from what we call a point source. Although there might be Listeria in chicken, raw chicken, Listeria in raw mince, or Listeria in boerewors, the strain of Listeria that we're seeing in patients all comes from the same source. And in order to prevent this outbreak, we have to find that source and stop that source from being contaminated. There's specific teams and dedicated people within the Department of Health and the NICD and the NHLS who do all the testing and the diagnosis and the treatment, busy doing our best to try and trace the contaminated foodstuff to source so that we can stop that food from reaching the public. When food is contaminated at a production facility, it contaminates what we call a ready-to-eat food. Even the 5 keys to food safety, which can help in most circumstances, may not be as effective. The bacteria is in the food that we eat. So this speaks to what we call food safety. Obviously, we don't want to eat food that's contaminated by any bacteria. The 5 keys to food safety include hand washing before and after meals, using safe food ingredients, cooking food thoroughly, being sure that food is stored at the right temperatures, and separating raw vegetables and food from cooked food are all ways that we can use to prevent contaminated food from contaminating other food, and also to prevent ourselves from contaminating food when we cook.